What's happening, gamers? Dr. Sam here with Pain-Free Gaming Performance, bringing you guys another video to help keep your body healthy so you can dominate the ladder, snag that top spot on the leaderboards. In today's video, we're going to be talking about one of the most common postural dysfunctions that I observe in gamers and how you can self-treat this dysfunction at home with some of the same tried and true techniques that I use to treat my patients every day in the clinic. The postural dysfunction we are going to be discussing in today's video is forward rounded shoulders. Now, let's take a look at this picture and see if this looks familiar to you. I'm sure it does, as this is a position that many of us spend our time in. We are gaming, working, or sitting in class. Notice the rounded back, compressed abdomen, and forward head that accompany the poor position of the shoulders. These are all postural dysfunctions that will be addressed in future videos, but for now, let's just focus on the shoulders. Now, Dr. Vladimir Janda describes the chronic result of this position as upper cross syndrome. As the pictures show, the muscles on the front of the chest wall become stiff and resistant to stretch, and the muscles between the shoulder blades become chronically elongated and lose the ability to effectively stabilize the neck and shoulders, which ultimately leads to sloppy movement and coordination of the arms and hands. Now, I don't know about you, but when I'm gaming, I need my wrists and hands to be working at 100%. Because if they're not, it could be the difference between getting that last score that I need to rank up or being forced to re-queue and hope that my teammates are reasonably competent. Now, it's important to note that I'm talking about posture. You need to know there is no one perfect position that you have to maintain all the time. And there's no one position that is so horrible that it needs to be avoided completely. The key to improving your pain and performance is balance, variety, and frequent movement to reduce the amount of time you spend in any one position, which will prevent stagnation and stiffness of your body's tissues. Unfortunately, the tendency with gaming and technology is to spend extended periods of time hunched over our keyboards, controllers, and smartphones with a disorganized trunk and disorganized extremity position, which inevitably sets our bodies up for inefficient function and pain. To address this problem, we simply need to take a little bit of time out of our daily routine and perform some maintenance on our joints, fascia, muscle tissues, and nervous system to allow for pain-free and efficient function at and away from our gaming setups. Now is your chance to intervene before your poor postural strategies get out of control and you start to develop pain that requires a more directed approach from a skilled physical therapist. The good news is, if you're watching this video, you now have a chance to start making small changes to allow you to have a lifetime of pain-free gaming performance. For the treatment techniques that we're going to be covering in this video, you'll need a few things. One tennis ball or lacrosse ball, one resistance band, and one foam roller, or 2 to 3 thick towels rolled up into a roll. Once you have these things, you're ready to start treating your body the way it deserves and reap the benefits of gaming harder and feeling better. Our goals with the following exercises will be to decrease the relative stiffness and resistance to stretch in the pectoral muscles, improve the ability of the thoracic spine to move more easily into extension, and strengthen the muscles in the posterior shoulder and mid-scapular region to decompress sensitive structures in the shoulders and arms, so you can game a little bit better. The exercises we will be performing are as follows: foam roller thoracic extension, self-perform pectoral myofascial mobilization, the corner or doorway shoulder mobilization, banded shoulder external rotation, and banded shoulder horizontal abduction. I hope you guys enjoy. Now let's cut to the video.
Thoracic extension with a foam roller is an effective method to reduce your body's perception of stiffness in the thoracic spine. To perform this technique correctly, you will first need either a foam roller or 2 to 3 thick towels rolled into a roll. You will want to find a firm and flat place to lay down to perform the mobilization. Place the foam roller long ways in relation to your spine and then slowly lower your back onto the foam roller, starting with it placed just above the bottom of your rib cage. Next, cross your arms, perform an abdominal brace, tuck your chin, and slowly lower yourself backwards onto the roll as you exhale until a stretch is felt in the back. Once you feel a good stretch, hold this position for 1 to 2 seconds and then slowly return to a more upright position. Do not push into any excessive pain or allow the back or neck to hyperextend. If you feel you aren't getting a good enough mobilization, you can also perform the movement with your arms in the overhead position or lift your butt into the air. You can then work your way up the spine, spending more time on areas that you feel are stiffer or feel good to mobilize. Other variations of this technique include rolling your trunk side to side to work on the ribs and the soft tissues attaching to them. Spend a couple of minutes performing this technique to help alleviate symptoms of stiffness or pain in the back, shoulders, or neck. The self-performed pectoral myofascial mobilization is a great way for you to improve the sliding and gliding of superficial soft tissue structures and reduce your body's perception of tightness in the anterior chest wall. To perform this technique correctly, you will want to take your mobilization ball in one hand and place it on the soft tissue of the chest muscles just under the collarbone on the opposite side of your body. From here, you can apply a moderate to deep pressure with the ball into the soft tissue and move the ball around until you find an area that feels tight or tender. The pectoralis minor resides just under the lateral aspect of the collarbone and is usually ripe with dysfunction and a perfect area to target with this exercise. Once you find the area you want to treat, you can then increase your pressure and twist the ball into the skin to grab onto the fascia in between the skin and muscles. Once you establish a good pressure, you can then move your neck or arms in different directions to create more tension and achieve a better mobilization. This exercise can also be performed by placing the ball on the wall and using your body weight to achieve an added pressure into the soft tissue of the anterior chest wall. Again, once you get a good pressure through the chest, you'll want to begin to move your arms and neck in various directions to increase the mobilization onto the pectoral muscles. After you spend a couple minutes mobilizing and you feel like you've achieved an improvement in the stiffness of the tissues, you can then reinforce these changes by performing a mobilization of the shoulder joint and chest musculature by placing your arm against the corner of the wall and rotating your trunk away from the wall. You will want to start with the arm at a lower angle, and as you improve, you can start to bring your arm higher until it is above shoulder level. If you find this position to be uncomfortable, you can also bend at the elbow to reduce the perception of tension within the arm. Banded shoulder external rotation is a great movement pattern to use as a starting point to begin strengthening of your posterior shoulder and rotator cuff musculature in a non-threatening position. To perform this movement correctly, you will want to move your shoulder blades into a back and down position with the elbows tight at your sides. Make sure your spine is in a neutral position and your abdomen is lightly braced to create a stable base for your pain-free movement of your shoulders. Begin the movement by pulling the band apart as you try to pull your shoulder blades together. Slowly return to the starting position while maintaining the stability in your shoulder blades and trunk. Make sure your movements are slow and controlled and don't let the tension of the band go on slack. Be sure to start with light resistance and increase as you get stronger. Banded shoulder horizontal abduction is another great way to train the posterior shoulder muscles, with the rear deltoids, rhomboids, and middle trapezius being the primary muscles involved in this functional movement pattern. To perform this movement correctly, you will want to move your shoulder blades into a back and down position with the arms held straight out in front of you and the elbows almost completely straight. Make sure your spine is in a neutral position and your abdomen is lightly braced to create a stable base for pain-free movement of the shoulders. Once you have established your base, and you will begin the movement by pulling your shoulder blades together first and pull your arms apart and back towards the spine until you feel you can't go any further comfortably. Slowly return to the starting position without losing the stability in your shoulder blades and trunk. It is important to make sure you are pulling the shoulder blades straight together and not shrugging your shoulders up, which will overuse your upper trapezius muscles and may lead to neck pain. By implementing these movements into your daily routine, you will improve the balance between the front and back of your shoulders and allow for pain-free gaming performance. Hope you guys enjoyed the video. Thanks for watching. Don't forget to like the video and subscribe to the channel to stay updated so you can keep gaming harder, longer, and pain-free.